The absolute best way to help your patient's complaints is by ignoring them. Yes, you heard me correctly. We are going to ignore them, but in a way that's not rude and in a way that will make complete sense by the end of this video. So let's walk through an example so this all starts to click. Let's say that we are working with a patient that has anterior hip pain. All right, so we know their pain point. And now we really need to define some terms so that it all starts to make sense. And what I want you to recognize is that there's a lot of synonymous terms. So we have the complaint, which is anterior hip pain, which is the symptom, right? And so they're coming into you and they're telling you essentially their pain, their complaint, and the symptom. What does this mean? This means that we are going to ignore it, but not really ignore it. We are going to have higher awareness. We're going to raise our awareness and recognize and be able to remove our mind from that complaint. Because a lot of times when patients come in, they tell us the complaint, aka anterior hip impingement, and then we go tunnel vision on them, right? We're only thinking of how do I fix this anterior hip pain, and we lose sight of the bigger picture, right? So ignoring the complaint is removing ourselves from it so we can see it for what it is. And what it is the symptom. And if we want to really fix long-term hip impingement, we want to fix the source. So the symptom's over here, the source is over here. Once we remove ourselves from that awareness of the complaint, we can now address the overarching picture. Let me give you an example. If someone comes to you and they're in this massive anterior pelvic tilt, you would first say to that person, oh yeah, Mr. Jones, we have a hip impingement because we have an anterior pelvic tilt. That's when the pelvis tips forward. It's going to decrease the space up here, increase space back here. It would be obvious. Well, this actually happens. It's just more at a micro level. All of our patients are coming into us with varying degrees of the position as far as our hips. And so we can think of it just like that. The source is coming from the position of the pelvis. Now, I will give a quick disclaimer. Sure, this person might have had surgery or other causes that are truly creating the complaint to be the source, but 9 times out of 10, the complaint is the symptom. All right, so I do want to give that quick disclaimer in case you're working with people that have different scenarios going on. But in general, we want to recognize that the source is what we should be fixing. So back to our example, we're in this anterior pelvic tilt. We need to get the pelvis in a better position before we start to address the impingement. The cool thing is once you fix the position of the pelvis, we just increase space here. And this person came in with a space issue. So a lot of times when you fix the source, you fix the symptom, which is also the complaint, right? And so you can think of it like a house. If you had a second floor problem and you kept fixing the second floor problem and it kept coming back and kept coming back, eventually you might say, there might be something else going on here. And it's not until you remove the second floor, first floor, and see and recognize that there's a foundational problem, fix the foundation and rebuild, now there's no problem, right? And so, in my opinion, I think the best thing we can do is ignoring our patient's complaints, ignoring the symptoms by recognizing, dissociating ourselves from them so we don't lose sight of the bigger picture. I think it's just really easy to get caught up in that. Once we remove ourselves from that small picture, see the bigger picture, we can always go and attack the source to get our patients out of long-term pain.